Hi friends, if you are looking for hair transplantation and you are having high grade of baldness, maybe grade 6, grade 7, this video is for you. In this video I'm going to talk about important aspects, which method, FUT or FUE or probably a combination, which method is good, how many grafts do we need, and is it really possible to cover high grade baldness with only one technique. We should know everything, each and every aspect of this. So let's start. I'm your friend Dr. Shail Gupta and I have been doing hair transplants for almost 20 years. So I'm going to share all my experience and expertise which I have gained during all these years. So many a times you will find people doing only one type of surgeries all across the globe. 99% or maybe even more percentage of clinics are doing only one particular method, that's called FUE. Although they sell it with different nomenclature, different names, but more or less it is only FUE. Only the name changes just for selling purpose. So there are all the techniques are good and they have their pros and cons, and while deciding this you have to understand the basics. So let's start. So as we can see here, this is the donor area and this is the safe donor zone, and it extends from here till here and till here. Okay, anything above and below this is called unsafe. I have made separate videos on this and you can go and watch the videos on my channel, Satya Hair Clinic. If you type, go to the channel, there are almost more than 350 videos there and all of them are loaded with a lot of information which you might not get anywhere else, which you may get once you get a transplant done, and then obviously if you don't know it you can't take correct decision. So this is safe zone and this is unsafe zone. When we are doing FUE surgery, we create gaps. We create gaps in between. As you can see in this picture, there are dots, gaps which we have created by doing FUE, because we are actually reducing the density in that area and maybe we are picking 1 out of 3. If we try to pick more than that, 1 out of 2, we are creating more scars and obviously more gaps. So now if we do another FUE surgery, suppose from the same donor area, what will happen? We'll create further gaps and the donor is going to look like something like this. This is just a created picture. I'm sure you must have seen a lot of patients on my videos where different types of donors, donor devastation when it happens with 1, 2 or 3 FUEs. So if you see this, the density is further reduced, and if we try to take out all the grafts which are present in that area, maybe by 1 session, 2 sessions, 3 sessions or n number of sessions, what will happen? If we take out all the grafts from this area is gonna look like this, a big empty patch, which obviously is bad, So, but in case I'm doing FUT, I can cut a strip from here, and as we did in the patient, I'll show you, and we can use all the grafts which are present in that area. There is no compulsion to take out 1 out of 3. Plus, we are dissecting it directly in microscope, so we can visualize the roots. When we are doing FUE, it is a blind procedure. We cannot visualize the roots. The roots get transected, which we cannot completely avoid. Obviously, if the surgeon is experienced over a period of time, the transaction rates would be minimal, but still they are. Now this was the donor. We did FUT and we did FUE as well, combination. So this was a high grade baldness patient. If you see over here, then this is immediate post-op picture where we did close to 3000 grafts by FUT. So since the area is stitched now, you don't see any scarring. I mean, the area is stitched now. So what happens? We have closed the gap. So patient ends up having a thin fine line, and the entire grafts which were present in that area, they are fully used. And if you see, we did around 3000 by FUT and 1500 by FUE. So if you look at this area from where we did FUE, it's a big area. If we try to do all FUE from this donor, then see 3000 from this we got. If I take out 1 out of 3, that means 1000. So that means for appropriate donor coverage, I am taking out 1000 grafts from there by FUE. 1000 here plus 1500 here makes it 2500. On the other end, I got 4500. So if I want 4500 grafts, I have to move up, further higher up. And if I am taking out grafts from this unsafe zone, which people who do only FUE surgery, they have to do this. They cannot survive without the unsafe donor zone. They have to make use of unsafe donor zone, no matter what they say, but they have to use. So it does not make any sense. And see, this is like the same picture, that picture which I showed you with markings. This is actually post-op picture, 1.5 months post-op. So if you see, very short hair and the area has healed nicely and the donor looks more or less the same, So that's very important. How to make maximum use of the donor area. That's very important. I'll show you another case now. And see, people who think that they can shave off their head and they can roam around easily without anybody noticing that they've got a transplant done in FUE. I've made a separate video on this, you can go and watch. But if you shave off, in most of the cases you will find white dots depending upon the extraction amount of grafts which have been taken out. So you can watch that video on my channel. Now coming to, now this is a patient of high grade baldness. Over here you can see a big crown to fill, okay, and frontal area. So we needed a good number of grafts. So in this patient I did first surgery by a combination of FUT and FUE, and we took out some grafts from the beard also. Okay, so if I show you the donor area after first surgery, can you find out the scar of first surgery? It is over here and it is very thin fine line, trichophytic closure. Even in shaved off head you can't see it. And now if I show you his donor from the middle portion, you see this is the scar of previous surgery, so it's barely visible. So we can and actually we did another FUT for which I have marked this area, and we got 2800 grafts from this FUT. So that makes the count 3000 in the first FUT, and second FUT gave me 2800. That means 5800 grafts, along with some FUE which I did in the first 2000 FUE. So that means, and in fact I'll show you his donor after second surgery. See, this is the donor after second surgery. He ends up having a thin fine line over here, and we can take out another FUT because the elasticity of skin allows us to do this, and we can still get a good number of grafts, maybe close to 2000 or maybe little plus. We can't do this with all FUE. I've explained this earlier. So we got a decent coverage in this patient, as you can see over here, and even the crown, which was like huge, very big over here, we could fill it up like this. Okay. So in high grades of baldness, obviously combination surgery makes sense, and obviously you can make use of other body parts, but that's a bonus, and that you can do with FUT combination. So whatever you do, you are getting more number of grafts by bringing FUT into picture. You just cannot do all FUE high grade baldness. That's a crime. That's a serious crime. So let's have a look at this case over here. Now this is a high grade baldness, not 6-7 but 5, a band kind of structure, and this front end and the crown was empty. So we did FUT surgery for him over here, if you see, and we got close to 3500 grafts, and only the frontal area was done. From the top you can see over here. So now you can see he has got a good coverage, and if I want to cover the crown, I can take out another FUT. Okay, with all these grown hair, without shaving off head, I can cover the crown area and cover the entire thing from scalp. There is no need to touch beard or body. I can do FUE also from the remaining area. Now showing you another case. Okay, over here if you see, this is the patient. Uh, Obviously, high grade of baldness, and we did his surgery. Okay, so we did FUT, and the surgery was done without shaving off the head completely. As you can see, the stitch area is like hidden behind the hair, and you actually don't see this hair. If you see, we have covered the frontal area. This is 7-8 months picture. Frontal area only has been done, and for the crown, the area behind this. Okay, let me show you the donor area also. So the stitch line is like very small trichophytic closure, and if you see, this entire area is empty. We can take out another strip from this area. The area above and below the strip remains totally untouched. We can take out FUE from this area, we can take out FUT, another FUT, and plus FUE from this area to cover it in the second go. If you see this patient, we did MHT, that is maximum harvest technique. So this is a high grade baldness patient, age around 60 plus. We did a combo of FUT, FUE, as you can see in this picture over here. This is immediate post-op picture, FUE, FUT. We took out some grafts from the beard also. So we did 3000 grafts by FUT. We did 2000 grafts by combination of FUE from scalp and from beard. So if you see, for less than 2000 grafts, because I think 500 grafts were taken out from beard also, and these are like kind of 1000 grafts from hair. So for 1000 grafts, see, we have used such a big area of FUE. So just imagine, had I done FUE from this area also, I would have got 1000 grafts. That means 1 out of 3. So 1000 plus 1000 means 2000. Maybe then we have to go to unsafe donor zone. Now this is the unsafe donor zone which I haven't touched. The advantage of this MHT technique is that we don't have to go to unsafe donor zone to get these grafts. Now, if you go to anybody who is doing high number of grafts, 3000, 20, anything above 2500, means that you are going to unsafe donor zone by FUE. In Asian patient, it is not possible. If you are taking out grafts from the unsafe donor zone, then these hair are not going to sustain for a long period of time. They'll fall, they'll thin out, because they are thinning out in this area also. So one has to be very careful, Now people make you scared of the scars. You'll have a big scar and all that stuff. See, this is just stitch removal which we did. FUE area is kind of healing. Now the density is little reduced. Now what I'm showing you over here is, again, so this area, if you see, now this was his donor earlier, and this is I think 2 months post-op or 3 months post-op pic over here. So it looks more or less same. The density is not much reduced. Now people will make you scared of the scars. They'll say that this is an old technique and all that stuff. See, you need to choose a complete clinic for your transplantation. What happens when you see results, you don't even know that the results have come because of the medicine called finasteride. Most of the clinics put their patients on finasteride immediately after transplant. I've made separate videos on this. You can go and watch on my channel. I'll keep talking about this. Now what happens, the miniaturized hair improve significantly post-transplant, and you think that the result is because of transplant, and you think it will be possible. It is just not possible. These guys, okay, I'll show you one of the cases over here. If you see this patient, I operated few months back. Now he had thinning, significant thinning in the crown area, as you can see in this picture over here, and some frontal thinning. So we did 1800 grafts by FUT, and most of the grafts were placed in the crown area and middle portion, and some work was done on temples also. Now if you see, now this is like stitch removal. We remove the stitches, trichophytic closure, the stitch line is barely visible, hair are growing through the scar tissue. Now if you see the result, 4.5 months result, it looks awesome. See, looks beautiful. Now the thing is, we gave this patient finasteride also, and finasteride is definitely contributing to the results. And when you see the results, always ask the surgeon whether you have given finasteride or not. If you are getting a transplant surgery done, ask the surgeon whether you are going to give me finasteride or not, and how long do I need to continue it. I am dealing with a lot of repair cases, and the reason is very clear why so many people come to Satya for repair hair transplants. Because when everybody gives up because of lack of knowledge in that particular, in all the aspects of transplants, because somebody who is doing only FUE, if the donor is kind of gone, he'll say, I can't do anything now. So in that case also I can do something. So take a look at his donor also. So people say that you have big scars and all that stuff. So see how beautifully this has been covered. So what happens when you already have got a transplant done, and that's FUE. So see, this guy got a transplant done, and that was by FUE. Somewhere else he came to be in this situation. He was told 4,000, 5,000 and that crazy number, but as you can see, there was kind of nothing there. So I repaired the case, but the donor was in very bad shape. So if you take a look, this donor was kind of gone. So even from this donor, FUT can be done. We did that, and if I show you, see, now this line over here, that's the FUT stitch line, and FUE already showing depleted areas because the previous FUE, and this is the line of FUT over here, which is like kind of barely visible. So it's very important that you don't end up with this kind of donor just because of gimmicks. This kind of donor can happen even in low grade of baldness. I receive a lot of patients, daily, and day by day the number is increasing. You know what? They come and in totally kind of botched up condition. See, even in young patients with low grade of baldness, this patient got a transplant done somewhere else, 2 times FUE for this area, and then he developed gaps behind it. Hairline also looks ugly, and I had to fill this up, but to fill it up, when I saw the donor, it was in this shape. So what can you do with this kind of donor? And see how badly the unsafe donor zone has been touched, up, down, both the sides, and this entire thing is gone. People who go for cheap transplants, most of them end up with this kind of donor. Okay, and those even who are going for costlier transplants, and if they are going for only FUE surgery, they end up with this kind of donor. Okay, so please be aware. And even in this patient, see, now we did FUT surgery from here, 2 strips, 400 grafts, and we filled up filled it up, over here. If you see, this is like long hair transplant which we did in this patient. So the fact is, in case you have high grade of baldness and you think that only FUE is going to give you a solution, you are wrongly mistaken. It's a crime, doing only FUE in such cases. Even if you have low grade of baldness and you think right now I can manage, I have enough donor, and you opt for low hairlines, you end up depleting your donor as you just saw. So you have to be very cautious and plan your procedures. Hair loss can be progressive. You may still keep on losing out hair. Finasteride can improve your results and show the thickness. A lot of patients come to me, they say, we were good when we got the transplant done for initial 6 months or an year, maybe 1.5 years. And then all of a sudden we notice that everything is going and kind of gone. And it happens a lot because they were taking finasteride, they were put on finasteride immediately after transplant. After some time, either they developed side effects or they stopped the medicine at their own, or the clinic asked them to stop the medicine, and then they had the floodgates were open and they lost the hair. So, but by that time, the clinic has sold this transplant result on internet, showing you uh, thick densities. People who are going for high density, I have made a separate video. Please go through the video, watch the video. You will understand a lot of things. You need to consult a surgeon who is like competent in both the techniques, and in fact the other techniques as well, like synthetic, SMP, or you know combinations, and who has been doing this on regular basis. A lot of people will say, "Oh, we do this, we do both," and when you go, they'll say, "Oh, we'll do this because this is best or this suits you more." So don't fall prey to such things, and be aware, be wise, think twice. So that's my appeal, okay? And together we try to find out solutions, and I keep on sharing my views, my experience through these videos. And I really admire the love which I get from you guys, and your comments. I try to personally answer them, and otherwise my team under my guidance answers these questions. You can, in case you want your assessment, you can write to us, contact us at given numbers, and we will try to make a customized treatment plan for you. Thank you. Love yourself. Stay blessed.